Midwifery in home births. After fully researching midwifery in home births, women should have the right to choose to have a midwife present in a home birth without it being illegal. Mothers' experiences in home births versus hospital births. A study was done among women and found that mothers had the most positive birth experiences in home births and the most negative experiences with hospital medical births. This study monitored women of all ages and ethnicities, as well as high and low risk pregnancies, and concluded that women had the most positive experiences with midwives present in home births as well as the least interventions needed during labor and delivery. And this is a picture of after a home birth where the mother is bonding with the baby, and this is a picture after a hospital birth where the baby has been taken to be monitored and assessed. Roles of midwives in home births. The midwife is there from early labor stages to help coach the whole family through the entire process and helps with all aspects such as pain management, and then assesses and cares for the mother and baby after delivery. The midwife is also there in case an emergency arises, and they know exactly how to deal with these emergency situations. They are also there for total support of the mother, baby, family, as well as for the safety of the mother and baby. Comparisons of home birth versus hospital birth. A study was done that compared 11,493 planned home births and 11,493 hospital births, all being low risk pregnancies, and looked at the safety outcomes of neonates and mothers, as well as the interventions used in labor and delivery. They concluded that there was no significant difference in neonate and mother outcomes, but home births attended by a midwife had fewer interventions during labor and delivery. Current rules and regulations of midwives in North Carolina. Under current NC law, only certified nurse midwives who have an obtained home birth license and are practicing under an attending physician are allowed to attend home births. It is also noted that midwives, even with proper certifications, license, and attending physicians, are still not allowed to attend home births with the following known complications: twins, vaginal breech presentation, prior cesarean delivery, or greater than 41 weeks gestation pregnancies. So even if a mother refuses to have a home birth, the midwife would be attending the birth illegally if she chooses to still attend the birth. A midwife can be arrested and charged, as well as even lose their midwife license for attending a home birth illegally. Opposing view, unsafe factors of home births. A study concluded that planned hospital births are safer than planned home births. It also noted an increase in neonatal mortality with the association of poorly selected candidates for home births. In the study or article, however, all pregnancies were taken into account, not just low-risk pregnancies as previously discussed. Again, though, if a mother is completely against a hospital birth, is it really safer for her to have the baby at home with no midwife present at all? In my opinion, no. I agree these risks should be addressed and explained extensively, but if the mother still wants to proceed at home, it is definitely safer to proceed with a professional in the birthing process present. And these two pictures I included is the typical hospital laboring process where they're monitoring your contractions and monitoring the baby's heartbeat, and you're kind of stuck in bed. Whereas the home birth process, you can move around, do different things during the whole labor and delivery. Concluding points. All women should have the right to a midwife present at their home birth if that's how they choose to give birth. A midwife should not have to choose between being there for their patient's safety and being possibly arrested and losing their midwife license. All mothers have the right to choose where to give birth in North Carolina, so why shouldn't we also provide a midwife for those who choose to birth at home? This is a real safety issue, and midwives shouldn't have to work illegally to help provide medical care to these women and babies. Lawmakers should really take these things into consideration. These are my sources for all of my information provided, and these is my one picture source, and I got all four of my pictures from this source.